I'd like to introduce you to a local colleague, and I mentioned her name earlier on, Janet Calvert. Janet is our regional breastfeeding lead, and Janet works in the Public Health Agency, and she has a very hefty job. Her job involves commissioning public health initiatives and leading on implementation of the breastfeeding strategy for Northern Ireland. And Janet also works with UNICEF BF Friendly and the BFI initiative as a professional lead for BF in Northern Ireland, and is a member of the UNICEF BF UK BFI designation committee. Janet is well known to all of us, and we hold her in the highest esteem, and she has been one of our midwifery leading lights in Northern Ireland with regards to breastfeeding. Over to you, Janet.
Good morning, everyone. I think this is the first time I have spoken to an audience of over 1,400 people. So I'm just slightly terrified. I spoke a few times at the Baby Friendly conference, and that's 800 to 900 people, but not this many. So thank you so much for the opportunity to share with you what we've been doing in Northern Ireland during this COVID pandemic and a bit beyond. I'm just going to share my screen with you now. So, breastfeeding policy and practice during the COVID-19 pandemic. This has been a really difficult time for everyone. And I'm sure, like everybody listening this morning, you're thinking, what is it like to be a breastfeeding mum and to miss out on all those opportunities and the joy of being with other breastfeeding mums, which I, as a young mum, many years ago, really found so beneficial. And so I thought this little picture was pretty fitting, because for some mums, it is about lonesome breastfeeding, and what can we do, of course, to bring them together at this time. As Marlene and Nicola have already mentioned, in Northern Ireland, we have the Northern Ireland Breastfeeding Strategy. You can have a look at it online. It has run this last 8 years and finishes in 2023. And it has 4 high-level strategic outcomes, and that's really where we pin all of the actions and the work that we do in support of the breastfeeding strategy. So outcome 1 is about supportive environments for breastfeeding throughout Northern Ireland, and we have a Welcome Here scheme. We have the work that's been going on across not just businesses, but also public and private organisations and our government organisations to ensure that that environment is there. Outcome 2, health and social care has the necessary knowledge, skills and leadership to protect, promote, support and normalise breastfeeding. And of course, that's about the training, that's about the policies, the Baby Friendly initiative, and having people in place that have the expertise to motivate and to lead and to develop mechanisms that help us to ensure that women get good care and continue to get good care. And then outcome 3 is about having high quality information systems in place that underpin the development of policy and programmes and which support strategy delivery. And we're very fortunate in Northern Ireland to have an annual public health intelligence briefing for breastfeeding, a very comprehensive document which takes data from our Northern Ireland maternity system and the child health system and uses that to inform where we are and support strategy delivery. And it's my colleagues in the Public Health Agency, Julie Neal particularly, who leads on that piece of work. And then outcome 4 is that we have an informed and supportive public. And that message has to get out there ongoing. And the taster that Marlene was giving us in terms of the Northern Ireland Life and Time survey and the attitudes and the confidence in breastfeeding, we know we still have a lot of work to do. We had our lovely campaign, Not Sorry Mums, but there's much, much more that we need to do to address that gap where people are not confident, are not informed about why breastfeeding really matters. So then moving on to what we've been doing during the response to COVID-19. As Marlene said, I worked for the Public Health Agency, and like Nicola, I've been called away to different pieces of work. But one of the first things I thought was a priority was to pull together a special meeting of the Breastfeeding Strategy Implementation Steering Group to see what are our priorities now? What do we need to do? But underpinning all of that for me, which has been an essential component, is to really capture any learning that we have. You know, what is better, what is not so good, what do we need to address moving forward? Because folks, sadly, we don't know how long we're going to be in this global pandemic, and COVID may be with us for some time to come. So we're going to have to learn to live our lives around it, unfortunately. And pardon me, and what does that look like for mums, for expectant mums and new mums? So then one of the things also that I've been doing, which has been extremely useful, I've been engaging with the 4 UK country leads for breastfeeding. We've been meeting regularly, and initially it was monthly, and now it's every 2 months or so. And that has been really useful because we need to know what's happening in England, Scotland and Wales, and how we can support each other, and where it's possible have a combined and joint approach to what we're doing. The move towards online courses, and we have the baby friendly initiative, and my colleagues there have been really working very hard on ensuring that information is getting out there to those that are leading, to those that are supporting women, and most importantly, that we are ensuring that the message about why breastfeeding continues to matter is out there and is loud and clear. We have the National Infant Feeding Network in Northern Ireland, and Pauline McKeown is now the baby friendly lead for Northern Ireland, and Pauline is now the new chair of NIFA-NI, and she and Liz Hood have been working to ensure that information is getting out there and support is there for those who are leading on breastfeeding. Midwifery-led tongue-tie services is something that we have been trying to address for some time, but COVID has meant there's a new urgency with that. And then promoting online support for women has been key to ensuring that support was there. So there has been a real move towards Zoom meetings, and our Sure Start colleagues and our colleagues, our infant feeding leads out there, have been developing those support services for women. PHA commissioning has had to be looked at. So in my role, I have contracts across community voluntary sector and health and social care trust. And it has been necessary to really look at how we can revise that and continue to deliver information and support on an online basis, but also that we look at how we're delivering the like of peer support as well. And even Tiny Life has really risen to the challenge of making sure that they continue to provide a breast pump loan service for those mums, which is really, really important. I'm wary of time. I can see here that we're running a bit over, and I will rush through these as best I can. But protecting breastfeeding and COVID was something that at the very onset, I was really anxious that we made sure that we had the guidance, that people were clear that women should be encouraged to continue breastfeeding and to start breastfeeding, even if they're suspected or confirmed cases of COVID, that mums and babies need to stay together, that we need to have skin-to-skin contact, especially after birth and during the establishment. And that's whether or not infants are suspected or confirmed of having COVID. So there has been a need to really ensure that we're protecting breastfeeding during this pandemic. And it should go without saying, but actually, the new studies and the new evidence that's coming out about the antibodies in human milk, the COVID antibodies, are really, really positive and given another platform for helping more of the public understand why breastfeeding is so important. And it's absolutely no surprise that actually COVID may protect babies from breastfeeding, at those antibodies are there in mother's milk. So those links are on there if you want to look at the guidance and look at those. I would implore you to go to the baby friendly statements, COVID statements, which are extremely useful. So what's the situation here in Northern Ireland? Well, you can see here, this is our breastfeeding rates at discharge from hospital as taken from the child health system. It takes a while for us to be able to quality assure this data, but there has been an increase in the last 12 years through from 2006 to 2012. And we can see there that's been an increase in discharge from 40% to 48.4%. So it's slow and steady with a wee dip along the way in 2012. But it still shows us that we have much more to do. You know, we want to get to a situation that more and more mums are breastfeeding in Northern Ireland. People have been asking what impact has COVID had, and I asked my colleagues in Health Intelligence to look at the data if she could, and we have had some data in here. So you can see from this, we would just have Q2, if you like, from March through to June is when COVID happened. But there is some reassurance there that it might not be as bad as we think, you know, that actually the breastfeeding rates are very similar this year compared to, now we've only got the first 6 months compared to other years, and actually there might be a slight increase at 51%. But as I say, this is only half of all mums who've delivered. This is the January to June data. So don't be getting too disheartened and too negative and thinking COVID is having a terrible impact on breastfeeding. It may not be. And actually, when you speak to women, there are opportunities for them to have the privacy that they need. There are some positives in the COVID breastfeeding experience. But you know, these messages about staying apart, you know, making sure that we don't touch our face and the wearing of masks, that must be so hard for the breastfeeding mums who during their interactions with their baby, they're having to wear a mask while out and about, you know, and that kind of thing, if they're on this mum's on public transport. But there are definite challenges there. And the other thing to keep in mind is that there are reduced support contacts within health and social care and probably with our volunteers. You know, midwives and health visitors are still seeing mums in their own homes, but these are the minimum contacts we would expect are happening. And at the start of the pandemic, when people were redeployed, there was a real step down in services. That had resumed over the summer, but we may be in a situation again because of COVID being an issue for staff being tested positive. Then there may well be a situation where women are not getting as many contacts again. So we just need to be mindful of that and keep in mind, what is the minimum? How can we interact? How can that phone call be made? But, you know, there's no doubt that COVID has had an impact, and things like online antenatal education, restricted visiting in hospital, which breaks my heart to think that mums in labour can only have their partner for a shorter period of time. You know, that's really, really hard. But there is more home births. It's not all negative, and there is an increase in home births, and that's a good thing for breastfeeding, no doubt about it. But the other thing that I'm hearing about as a result of my other areas of work is technology poverty is a real thing for many families. We can make an assumption that everybody's online and that we've all got mobile phones, and that might be the case, but actually there is something there about making sure that we don't assume that mums can go online and download something, because many families in poverty are sharing devices. You know, that you've seen it on the news, and you've seen it in other, that families are having to, the kids are trying to do their homework on one mobile phone that doesn't have Wi-Fi, and the expense of that. So we really need to consider that. And the other red flag for me is social isolation. Social isolation and COVID is a huge concern, and it's a priority of the Public Health Agency, and it's a really important consideration for breastfeeding mums. We are living our lives on a screen. I love this picture of the daddy though. I just think that's hard. And I don't know about you guys, but I'm exhausted by screen time. I seem to be spending my life looking at a screen, and there's nothing to beat that face-to-face interaction and just even having a phone call. So do remember that. We really need to look after these mums. So where's the help? We have breastfeeding helplines there. We have the National Breastfeeding Helpline. We have the wonderful work that our voluntary services do for support, and we've breastfeeding in Northern Ireland, specific support for women with ongoing challenges. But yeah, we just need to be mindful of capturing the learning, what works and what doesn't, and building confidence. Many of you will be familiar with this. This is a little checklist that I think is really important, because women will stop breastfeeding in the absence of knowing whether things are okay or not, of having that ongoing reassurance. So we need to signpost them to where to get help, but also just give them the tools that they can. I know maybe for some people tick boxes don't do it, but something like this could maybe make the difference. And we need to capture the learning. So I have explored, I'm really conscious of time, I'm going to race through these, the learning with focus groups with women. I've managed to secure some funding, and my colleagues in health intelligence are going, now it's just a small amount, to look at what it's been like for women during COVID. You know, these are some of the questions that we could be asking. And then we need to ask midwives and health visitors and supporters and Sure Start folk, how's it been for them? What's changed? What can we do differently? What are the priorities? There is an urgency in this in getting answers to these questions. And so what do we need? We need strategies to help mums stay safe and connected. We need practical solutions to address isolation. We need to acknowledge too that we are all trying to do our best. This is not the time to be divided. We need to all work together and not to be critical of each other. Stay positive, try and develop and record and capture those solutions, please. And let's all of us keep listening to women and learning. The PHA website, I just flicked that up because there is COVID information there, general COVID information, and I just want you all to stay well informed and to stay safe. And finally, that's me. That's all I wanted to say. Sorry about the rush, but thank you so much, Marlene, for the opportunity, and Nicola and colleagues.
Janet, wonderful presentation. And I'm so sorry that we haven't got a whole hour for you, because you've so much to share with us. And we so wanted to hear what you've got to say, because there's so much happening in breastfeeding right now as a result of COVID. So thank you very much for all the information you have shared. And you've got quite a few questions. We don't have time to answer them all, but I will just say to you that there is a request here for access to any mothers who may be who are COVID positive and are breastfeeding. Are there any links or any guidance in relation to that on their website? Is there any links that you could share?
So there is in the Public Health Agency, we have a parenting online and sort of antenatal forum. There's a website there, and I could maybe perhaps share that website. But in terms of the information for women on COVID and breastfeeding, we really have the guidance from the WHO and the Royal College of Obstetricians and Gynecologists, which is our reference point. But really, it's about ensuring that women have, are getting the right information and are encouraged to continue to breastfeed. They don't need to stop breastfeeding.
Janet, thank you very much. One last question, because it's a quick one and you can answer it. Who's representing Wales in the UK country Leeds? Somebody wants to know the name of your colleague in Leeds.
It's Sophia. In Wales, it's Sophia Bird.
Sophia Bird, thank you very much. I'll have to leave the questions there, but thank you very much, Janet. It's fabulous to hear so much wonderful work going on at a local level, and keep up the good work. Thank you very, very much. Thank you.